So what are we talking about today?
We're talking about how high blood pressure can be treated, how we can see it from Buteyko's view.
Blood pressure is exactly what it's called, the pressure of blood in the circulatory system. And the pressure in combination with the pulse affects the rate at which oxygen is discharged from the hemoglobin. But the principal mechanism actually is the level of CO2. So the higher the level of CO2, the more easily oxygen is discharged from the hemoglobin due to the Bohr effect, the Bohr Law. Now, if there's not enough CO2, which is usually in the plasma, whilst the oxygen is in the hemoglobin, then the body will either have to increase the pulse, which is what happens when you do physical work,
Yes.
or it can increase the blood pressure. And this promotes perfusion and diffusion and all these mechanisms. So people are very scared about blood pressure because too much blood pressure will damage vessels. And yet, everybody is recommending physical exercise. Doesn't physical exercise elevate blood pressure? Of course it does, but it's a temporary elevation and it promotes this oxygen uptake and so forth. So by improving the level of CO2 in the organism, and in particular dissolved CO2 in the blood, you promote the uptake of oxygen, which means the body has less requirement to elevate the blood pressure. And also the action of CO2, its levels will determine the aperture of all vessels. So as vessels expand, so blood pressure should come down, but only in terms of if the oxygen requirement is being met. If the oxygen requirement is not being met, either the pulse has to increase or the blood pressure should increase. And then that's why those people who take blood pressure medication, these dilators, of course they work because they will open the aperture of the vessels forcibly. The problem is now the organism has less management control of how to deliver the amount of oxygen required.
Yes.
Because the vessel is forced open. So it's more difficult for the organism to deliver oxygen. It still manages in most times, but quite often, and eventually always will be the case, if the blood pressure medication is strong enough and enough is taken, and if the organism can't constrict the vessels because of the medication, then there'll be deficiency of oxygen. Not in terms of overall deficiency, but deficiency in terms of delivery. So now the body will have to somehow budget how much oxygen is delivered to whichever department's tissue which requires it. So it's much better, obviously, to normalize your breathing so the body can more easily discharge the oxygen from the hemoglobin, and so that vessels come to their right aperture according to requirement, and you're not taking this medication, which is, it has unwanted consequences,
Mm-hmm.
And I do remember a case where a very nice chap in Singapore, he sort of on one side had his heart specialist, and on the other side he had me, and he's trying to sort of go between both of us. And I think the heart specialist didn't really think that Buteyko method was serious, because breathing method, doesn't seem very professional to him, perhaps. So he said to the guy, yeah, it's fine. You can do that method, it's no problem, but make sure you stay on your medications. And I said to the guy, well, as you practice Buteyko method, your requirement for medication may become less, So you should see your doctor for him to adjust it down as, you know, as your vessels begin to dilate more easily. But he didn't do that, actually. You know, it's hard to see your doctor. You know, you can make an appointment. It might take a few weeks. And the doctor more or less already gave him the policy, stick with your medications. That's for sure. And you can do a method if you like, you know, no problem. So he did that. And I got a call like at 6 o'clock in the morning, some weeks later, from his very distressed wife that he could not get out of bed. He was conscious, but he could not get up. If he would get up, he would sort of faint. So I said, and she woke me up in the early hours of the morning. Maybe I didn't have my presence of mind, you know. So I said, well, you better take him to hospital or call a doctor or something, because it seems very strange. And it didn't occur to me. He ended up going to hospital, and they said his blood pressure is so low because he'd been practicing Buteyko method and he's been taking the medication. The two things came together and caused him to have such low blood pressure, he couldn't get up in bed. So they had to give him something to increase his blood pressure.
Yes.
So, I mean, imagine how stupid the whole situation is, that he's now taking medication to increase his blood pressure, and we're trying to reduce the blood pressure. That was many years ago. So these days I'm more skillful in determining what people are doing with their, I hope I am, with their medications. And it should be done in a bit by bit way, gradually.
Yes.
You can monitor. A lot of people find that when they practice method that the blood pressure doesn't change, but their pulse changes. And then their pulse goes up and blood pressure goes down. And then pulse goes down and blood pressure goes up. And so these two things, and they work opposing each other. And as their control pause goes up, both of them flow downwards. But in the immediate sense, they work opposite to each other. That's what I've seen anyway. So, yeah.
What kind of control pause do we need for this effect to start happening, for this downward movement of blood pressure and pulse?
Well, in cases of extremely high blood pressure, it's easy to get a result. You know, these extreme cases. I mean, it's a bit like someone who's very poor, just even, you know, 20 euros is a big deal for them. So in cases where you've got very, you know, acute high blood pressure, even with a very low control pause, if there's some improvement, it can show some results. For most people, like your middle-aged men and so forth, who start to have blood pressure problems, I'm just guessing, but I mean, whenever there's improvement, it's not instant reaction. It's not like asthma symptoms, migraine. It's a deeper system. So the effect is not immediate, but I think around 30 seconds, 30, 35 seconds, usually you don't have high blood pressure anymore. If your control pause is around 30, 35, which is still too low, of course, according to what it should be. But I don't really see much in the way of high blood pressure, arrhythmia, tachycardia, and all this sort of stuff with a CP in the 30s. I mean, a CP in the 30s is not ideal, but it's enough usually. But I've also seen lots of cases when their control pause is 19, they have high blood pressure and lots of other symptoms, and control pause goes 28, 30, 35, whatever, and they're not requiring blood pressure medication. It still might be a little bit high, but it's greatly improved.
Yes.
It may not be perfect yet, but I mean, it's much better to use this method than this medication, because you're stuck on the medication now, and it will get stronger and stronger, and the body has one less maneuverable. It can no longer so easily increase and reduce the aperture of vessels because you've stuck it open.
Yes.
You know, that would be the same, if you can imagine the same idea, well, similar. What if I organized it so that your car, the engine always ran at a higher speed, so you don't have to use the accelerator? But when you stop, the engine is revving very fast. It's not good. That's a terrible analogy, but you know what I mean. It's like,
yes, it's not a smooth way of operating the circulatory system.
Not a good way. Yeah, in the beginning, yes. Oh, everyone is so happy, you know, because the guy's got high blood pressure and he's scared to death because it can put strain on the heart. Vessels can be, due to their lack of tonus, they can be damaged by excessive high blood pressure. And now you take a few pills and, oh, it's like cured, you know, and they're very happy. What they don't realize is there's now all these other ramifications and problems which now develop into other health problems.
Yes.
And often they're not related. Well, they are related, but they can't join them. They can't make the connection. So you take high blood pressure medication, everything is good, doctor is happy, and then you start having memory problems, or you start having weight problems, or you start having other health issues. And the doctor might say, that's not my department. Your blood pressure is fine. Blood pressure is perfect. Ah, okay. Yeah, but you now have other problems because you're taking this medication which forcibly opens the aperture of the vessels. But as I said, in the beginning, it's usually a beautiful solution, works well. And they're not, and the blood pressure medication is not usually toxic, or it's pretty good stuff, really. It works very well. And they've developed them very nicely, been at it for a long time, so they're quite good. But the overall health will suffer if you override such an important system with this synthetic intervention. And so I wouldn't recommend, if you have a choice, if you can normalize your breathing, improve your breathing, and thus no longer require this synthetic approach to keeping the vessels sufficiently dilated naturally, that's what you should obviously go for, you know.
It's a better choice. Yes.
Of course, it's a better choice. Yeah. And the same with the pulse and things like that.
Thank you, Chris. Thank you very much.